Now, let me first go through. I have muted all of you for some time. Let's say I'm going to unmute you after some time. Or if you have any doubt, you can raise your hands as we all know. Now, let's say, for example, what we have learned till now. Okay, the first point we have learned is the most common investigation we're going to learn in this. Second important thing is we have learned about the shadows. That means something which is white, something which is black, something which is gray, and all those different types of shadows. Third thing we learned about a normal anatomy of the X-ray. That means how exactly lungs look like, how exactly trachea looks like, how exactly diaphragm looks like, how exactly the ribs look like, how exactly the cardiac shadow looks like, what is right border of the heart, left border of the heart, base of the heart. So all those things we have learned in the first lecture. Now, those who have not attended the first lecture can get the screenshots. But remember, these lectures, if you are able to attend online live, and that is what is a different thing. Otherwise, on YouTube, you see so many videos. And but the thing is, you cannot ask doubts in that. And if you have one doubt in the video, then everything which is after that doubt is cannot be understood. And because of that, we plan to have this online live lectures program. You may take the screenshots in between. I think let's start with something which is new. And in the last lecture, remember, we also have learned that what are the rules of X-ray. First thing is don't make panic. Identify the X-ray belongs to which patients. Identify the right side and the left side. Remember, we have learned that. We also have to identify the right side and the left side. And then we have something called an ABCDE of the X-ray. And now, what is that ABCDE? Of course, we have learned that ABC during the emergency medicine, if you remember, airway, breathing, circulation, and all those things is an emergency medicine. But we also have ABCDE in case of an X-rays. Now, what exactly is those ABCD? Let's can take a screenshot right now. If you have, you may keep your screenshot button on. So you can take the screenshots after I finish writing. Slides has got less, but after we finish writing, it becomes more understandable. It becomes more understandable. Okay. Now, what exactly is ABCDE? We thought about. Now, remember, what is B, A? Now, remember, whenever we are interpreting any X-ray, we will have to go through ABCDES approach. A stands for airway, B stands for breast and the bones. Remember, a lot of times we have a couple of X-rays in which, because of the breast shadow, some misinterpretations can happen in the X-rays. And that is what I'm going to show you those X-rays. So B stands for breast and the bones. Bones may we see the lung, we see the ribs, clavicle, and we see the thorax. And remember in the last lecture we have understood how to identify whether the X-ray is centralized or not. Remember, before we go to any X-ray, centralization of X-ray is most important. That was there in the last lecture. Those who have attended will be definitely able to make a difference. C stands for cardiovascular shadows. Here we see the cardiomegaly, whether the right border of the heart is problematic, left border of the heart is problematic, or it is the base is problematic and all those. Then we stand for a diaphragm. Then we examine the lungs. In the first lecture, we examined the upper zone, middle zone, and lower zone. Remember, because in all the three zones look differently, little differently. So last lecture was a normal X-rays. Today all abnormalities. Some of the abnormalities. This presentation we have made has got about 130 slides, and we may require maybe 3 or 4 lectures to finish those, so that proper understanding can be made. So an S for a soft X-rays. Like for example, we have the trachea, we have breast shadows, we have thymus gland is also seen. Thymus gland is enlarged. Then we have the breast. ABCDE approach. ABCDE approach, and that is what is important one to understand. Go through this method. Interpret X-rays should go these method or these finding. You can take the screenshot right now. Later on, somebody can share it on the group. Somebody can share it on the group. Right. Now let's go to what exactly A. A stands for airway. Now, so what exactly we see in the airway? This is the trachea. This is the carina. Remember what is carina is? This is what is, let's say, trachea, and we have a right bronchus, the left bronchus. So the angle is called as an carina, angle or a right angle. And also I can say the main bronchi. So this is what is about an airway. We see trachea, right and left bronchus, and the carinal angle. I'm going to show it to you. Now, what exactly we're going to look into the trachea? First, let me have a data and then we can show the X-rays. So first thing, what we're going to see in the X-ray is whether the trachea is central or not. Remember, those pathologies can be either a push or a pull. Remember, we have understood in the medicine, this was the lungs. Now, trachea need to be central. If the trachea is deviated either on the right side or the left side, it can be some pathology. And remember, those pathologies can be either a push or a pull of the trachea. I'm going to go through. So, what exactly can be trachea can be pulled by? Now, trachea which is central can be pulled by a lobar collapse. Remember, it is pull, then it is on the same side, of course. That means pull of the trachea and the pathology I'm talking about. In this case, it is on the same side. That means if it is a lung collapse, trachea will be pulled on the same side. It's a right lung collapse, the trachea will be pulled on the right side. So pathology as well as pull are on the same side. That is what is called as pull and push terminology. Pull and push terminologies. So in the trachea, if it is central, it is normal. If it is pulled on because of something, those pathologies can be lung collapse, can be fibrosis because of an old tuberculosis. Let's say, for example, right upper lobe, let me have a green color in this. We have tuberculosis, and is old tuberculosis, is a healed tuberculosis. So it's going to pull the trachea because of the fibrosis. Because of the fibrosis. Again, it's going to be the same side. And also, it can also be the pathology or you can say surgery, lobectomy. When the lobe is removed, of course, an empty space is created, and because of that, the trachea can be pulled. So, if the trachea is deviated, think about these pathologies: lobar collapse, fibrosis, or surgery. So, if it's the trachea is shifted on the right side, and also this is seen, this is what is again say not an active pathology right now. It is an old pathology.